Hello, everyone, and thank you again for being here in this conversation that we have been having about what transformation of mental health through social work looks like. We have been doing these posts on Mondays and Wednesdays just to be able to be in a conversation and start looking at different elements of what it means and what impact there may be for us, on us, with us. And some of it is particular to the role of social workers in that transformation. And on Mondays, we have an article that we refer to be able to be more sort of direct in how it is that we are looking at the role of transformation in mental health. Today, the conversations that we have on Wednesdays are much more about what comes up in this whole process. What are some of the insights that have been coming out through the different conversations? All of this related to the articles that we're doing, the video posts that we're doing, our social work power certificate course that happens on Fridays. And again, this is something that you could come to as a one-off. It's something that you can continue to enroll in on a regular basis. All of this leading to a panel that we're going to be doing that is going to be really about the transformation of social work through the transformation of mental health through social work. And so some of the conversations that we've been having recently is about what and excuse me, and we've mentioned this before in terms of what does that actually look like for us? Like if we were to start considering the transformation of mental health through social work, because we are in these very, very unique positions that we're in, what would this actually look like? And some of the conversations have been wonderful in the context of really thinking about it in the same way that we sometimes think about things like health as a preventive model rather than a reactionary model, which is, I think, what many of the people that we're currently communicating with, and myself included, believes about how we sort of operate mental health services currently. It's about reactionary rather than it being about prevention. And so if we were to really look at this from a prevention standpoint, what would it look like? How would we look at mental health from a prevention standpoint? And some of the things that have come up, number one is, we are, the annual exams that we get, we have annual exams that we have to get for either work or for school, or because they're annual exams and our insurance covers wellness exams. So what would that look like as part of like an annual, mental health evaluation that was covered by insurance? And it was one of the things that was required for school or for work, or just because your insurance allows for it, or so that there is a measurement of your own personal health journey and your health being encompassing and including your mental health. So what would that look like, and what would that be like if we created it, in this, vision of a transformed mental health system where it truly was about prevention, and we really did look at things like having things like annual mental health evaluations, right? And then being able, just like if we were to get an annual physical exam and something comes up on the physical exam that we have, increased blood pressure, right? It may not yet be at the level of needing medication, or it does, who knows? But then what would happen is that if there is an indication that your pressure has gone up, you go back, or the doctor asks you to monitor it. You get a little pressure cuff, and your doctor asks you to monitor it for the next 2 months or whatever it is. And then if there is a consistency around your pressure being up, you come back in for another appointment and you start looking at lifestyle modifications, or there is a conversation about medication or whatever it is, but all of it is a model of prevention rather than you just had a heart attack and now you're doing something about it. Because how we do things in health are based on more preventative models. When we go for mammograms and sonograms and, colonoscopies and annual physical exams and eye exams and all of those things, there's all this stuff that is, or our dental exams, right? All of this is about prevention and wellness so that we can address things prior to them becoming so significant that, one, it's more costly, two, it has a greater impact on our overall, wellness, and so again, it really sort of is an interesting place to be in terms of like, what would that look like? What would it look like to really be able to do like prevention where, it goes all the way to like prior to birth, right? Like where your parents are in this preventive model also. What would it look like in the school systems? If we were operating from prevention, right? Where prevention also includes education, where things like mental health become a normative conversation and not something that has stigma associated with it or that is included in all of the things that might be wrong. So there's also question about this distinction as well between how we talk about, as I've kind of talked about a little bit, as we've talked about things like health and mental health. And if we continue to make mental health a separate category, it continues to be something that actually is different than health. And what we know is that health and mental health are the same thing. And so part of it is also about considering a change in how it is that we communicate about things like health, where health becomes inclusive of mental health. And it's not necessarily the transformation of mental health, it's the transformation of health. So those are some of my thoughts today. I would love to hear what you think about it. Please put some comments below. Join us for any one of our sessions on Fridays or any sort of communication that you want to have with us. We love you, and we look forward to seeing you all again very soon and hearing your comments and having you join us.